Cotrinna Williams, and today I'll be talking to you briefly about muscular dystrophy. Muscular dystrophy is a group of genetic diseases that are caused by a genetic mutation. That is, it is a change in genetic material that can be passed on from the mother to the unborn child. It usually affects muscles and it progresses very quickly. Most common types of muscular dystrophy. Some of the types, there are 8 to 9 types, and these are the most common types I will describe to you. Duchenne muscular dystrophy is most common in childhood, and it is an X-linked disorder, which means the gene is passed on from the mother to the child. Becker is similar to Duchenne, but it is not as aggressive as the Duchenne. It affects 1 to 2 in 10,000 males between the ages of 5 to 24. Myotonic has different types. In infants, it's type 1. It can be very severe, and the infants have trouble breathing and swallowing. They usually do not live through the neonatal period. Adults, myotonic type 1, may develop in adults and cause cataracts, hand and lower leg weakness and muscle wasting, and grip myotonia. Later onset type 2 myotonic, stiffness can occur and myotonia in the thighs and hands. Neck weakness, hip weakness, it's difficult to climb stairs. Duchenne is usually found in young boys. They walk very late. They display a Gower sign and usually have intellectual impairment. The Gower sign is this. When using the hands, they push up with the legs. So this displays the Gower sign. This is the child getting up and then having to use its legs to actually stand up straight. Also, in muscular dystrophy, children or the person tends to have shoulders and arms are held back awkwardly when walking. They have a sway back. They have a large round belly, which is because the belly muscles are weakened. Knees may bend back to take weight. They have poor balance when they fall, and they have a tight heel cord, and this is where contractures begin, and the person looks like they're walking on their tiptoes. Also, some of the complications from muscular dystrophy, neurologically, you can have seizures, headache, brain tumors, speech impairment, scoliosis can occur. This is a scoliosis spine versus a normal spine. Also, you can see the deformalities of the back of this person. Also, some of the complications are in the digestive tract. You can have nausea, vomiting, stomach pain, and constipation. Muscular dystrophy, also, this is a display where you have a normal muscle bicep versus a bicep for muscular dystrophy, and you can see that it's very weak and thinner. Down here, we have how the gene mutation of the genes. This is a muscular dystrophy gene. Test and diagnosis during muscular dystrophy. The first thing you would do is see your physician. Then you'll go through a history and physical, and then you'll start doing testing. There are several testing that a doctor can do. Enzyme testing, which tests the CK level, which is creatinine kinase in the blood. In the absence of traumatic injuries, this level will be high, which would suggest a muscle disease as muscular dystrophy. Also, genetic testing. Blood samples can be examined for mutation in the blood. Different mutations can tell which type of muscular dystrophy would be found. Muscle biopsies also could be used, and electromyography, which is a test that's inserting the electrode needle in through the skin and into the muscle to be tested. Electrical activity is measured as you relax and as you gently tighten the muscle. Changes in the pattern electrical activity can confirm a muscle disease. Treatments of muscular dystrophy. Muscular dystrophy cannot be cured, but it can be treated. You can use medications such as corticosteroids, which is prednisone. Prednisone and corticosteroids help strengthen muscles. Also, one of the complications you can have from this long-term use is a risk of fracture in the bones and poor bone loss. So the bone begins to weaken. You can also do therapy to help. Range of motion for flexibility. Muscular dystrophy can restrict the flexibility of joints, which cause contractures. So doing range of motion can help the flexibility of the joints. Mobility aids such as braces, wheelchairs, and walkers can be used to help maintain mobility and independence. Also breathing assistance. Breathing assistance such as ventilators. Some patients with muscular dystrophy become ventilator dependent. This includes my presentation over muscular dystrophy. And here is my presentation. And it also has different muscular dystrophy. It's a person, how the person stands again, and the X-linked recessive, the genes, as the mother, how the mother passes it to the child. Thank you.